Today we're going to talk about acid-base balance and arterial blood gas interpretation, or ABG interpretation. So when we talk about acid-base balance, what we're looking at specifically is acidosis versus alkalosis. Our body's normal pH, which is measured in hydrogen ion concentration, the range is 1 to 14. And our body lives between 7.35 to 7.45. Anything outside of this range, we will start to have problems. If the pH drops below 6.8 or goes above 7.8, these are processes that will likely result in the death of the person. So again, we live in that 7.35 to 7.45 range, and we have systems that are in place to help buffer this and reverse whatever process is developing. A patient will be in an alkalotic state or alkalosis when their pH is above 7.4, and they'll be in an acidotic state or acidosis if their pH is below 7.4. I say 7.4 because that is the middle number between the 7.35 to 7.45. So anything above 7.4 is alkalosis, anything below 7.4 is acidosis. When we look at the causes of acidosis, respiratory acidosis will result when there is an increase in the CO2 levels in your patient. This can be as a result of a drug overdose, which depresses the respiratory system, so your patient is not breathing as effectively, they're not breathing enough. It can be a result of pulmonary edema, where there's extra fluid in the lungs, decreasing the ability to oxygenate the blood, which will increase your CO2. Airway obstructions or mechanical ventilation, if the vent settings are not appropriate, the patient won't be able to get rid of CO2 effectively. In diabetic ketoacidosis, shock states, metabolic acidosis will be present where your pH is low and then your bicarb level is low, for that HCO3. Renal failure can also cause acidosis to develop. When we look at the causes of alkalosis, or this is your pH rising above that 7.4 range, if a patient is hyperventilating, so their respiratory rate is elevated, this is that shallow breathing, rapid breathing, tachypnea, they are blowing off too much CO2. In high altitudes, you'll see patients with this problem. Pregnancy can often cause this, hypoxia, decreased oxygen levels will cause this, and then the initial stages of a person with a pulmonary embolus. Loss of gastric juices, so we talk about patients who have prolonged suctioning, they have an overdose of antacids, can cause issues in the balance, and then potassium wasting diuretics. So we have the diuretics that get rid of too much potassium can lead to these imbalances. So when we look at an arterial blood gas, we need to look at what is actually measured. So your physician orders an ABG on your patient, you need to know exactly what's going to come back in that lab value. So this is something that is drawn from the arteries, your radial artery. So we have to have that oxygen-rich blood. So when we get these results, we're going to first have the pH, which is that hydrogen ion concentration. Again, the range is 7.35 to 7.45. We're looking at the PaO2, which is the partial oxygen concentration. That'll be 80 to 100 millimeters of mercury, for your partial pressure of O2. Partial pressure of CO2, PaCO2. This range is 35 to 45 millimeters of mercury. This is your respiratory component of the buffering system. HCO3, which is your serum level of bicarbonate. Your levels are 22 to 26 milliequivalents per liter. This is your renal component or your metabolic component. So CO2 equals acid, HCO3 equals base. And then you'll also get your oxygen saturation, which we want it to be 95 to 100%. So homeostasis, this is our buffering system. So your respiratory and metabolic components work to keep our body, to keep that pH level within the 7.35 to 7.45 range. These systems act immediate, so when our body senses an imbalance, the other system should start to act immediately to correct the imbalance. It's comprised of chemicals that change the strong acids into weaker acids or will bind to the acid and neutralize its effect on the body. Our body has more ability to buffer an acid than it does to neutralize a base. So our body is much better at correcting an acidotic imbalance than it is at correcting the alkalotic imbalance. Your alkalotic imbalances are going to result in more detrimental effects to the patient because it is harder for the body to compensate for that. In order for our body to maintain that homeostasis, our renal and respiratory systems have to be functioning in order to be effective. So if we have kidney issues or we have a respiratory problem that we're not fixing, then these systems cannot buffer the imbalance. So your respiratory component, this is the control of your CO2 level through our respiratory rate. Works in minutes. We have that imbalance, our respiratory rate will either increase to help blow off the CO2 or it will decrease to help retain CO2. So your increased rate and depth of respiration will decrease your CO2. So when we're tachypnic, we have decreased levels of CO2. CO2 also combines with the water in the plasma to form carbonic acid, which is our actual indicator of the acidity. We see this also in our PaO2 levels, so we want our oxygen levels to be between 95 to 100%. Your PaCO2 level is measured in the 35 to 45 millimeters of mercury. We will see our respiratory, the components, so elevated in acidosis and then decreased in alkalosis. And when we measure these, we actually flip this component. So a level of 45 or above is going to indicate acidosis, and a level of 35 and below will indicate an alkalotic state. For your metabolic component, this works by controlling the serum levels of bicarbonate, or your HCO3 value. HCO3 will bind to the free hydrogen ions to reduce their concentration and decrease the acidity. So when this is elevated, that's an indicator of alkalosis. This takes days for this component to work. So again, the respiratory component can work very fast. Within minutes, our respiratory system can change our rate and depth of respirations to try and correct the imbalance. The metabolic component will take a few days to be effective. The normal range for this is 22 to 26 milliequivalents per liter. So you'll see it elevated in alkalosis and decreased in acidosis. So below 22 will indicate acidosis and above 26 will indicate alkalosis. An overview of the imbalances that we're looking at. So there's 4 total imbalances that we are interpreting off of our ABG value. Again, the respiratory acidosis is a buildup of CO2. which we see with hypoventilation. Respiratory alkalosis is the decrease of CO2, which we see in hyperventilation, so they're blowing off too much CO2. Metabolic acidosis is that buildup of lactic acid where we see the decrease in bicarb. And then metabolic alkalosis is the increased bicarbonate level causing that increase in our blood pH level. When we look at causes of respiratory acidosis, again, this is hypoventilation or hypoxia. So they have that increase in CO2. Rapid shallow respirations, low blood pressure, vasodilation, shortness of breath, hyperkalemia, dysrhythmias, we'll see with the hyperkalemia, drowsiness, dizziness, disorientation, patients who just are not breathing effectively, muscle weakness, drug overdose, COPD, pneumonia, your respiratory components where your patients just are not ventilating effectively. Respiratory alkalosis, you'll see this with the deep, rapid breathing. Seizures can cause this. Your patient is lethargic or confused. They might be lightheaded. This can be as a result of the tachypnea or the hyperventilation. You'll often see these patients complain of dizziness. They'll get those carpal pedal spasms in their hands where their hands will contract. Hypokalemia can result in the respiratory alkalotic state, the numbness and tingling of extremities. Again, your hyperventilation is your most likely cause. Anxiety, pulmonary embolism, fear, anything where your patient is just breathing too quickly, or if your patient is on a ventilator and their vent settings are not appropriate, causing their respiratory rate to be too fast. When we have metabolic acidosis, a whole bunch of causes for this. So you have your electrolyte imbalances related, hyperkalemia, confusion, drowsiness, low blood pressure. You're going to see these patients have warm, flushed skin as a result of the vasodilation. Nausea, vomiting can be a cause. They essentially have too much acid in their blood and not enough bicarbonate to neutralize that acid. Kussmaul respirations are that rapid breathing. It's a compensatory hyperventilation because they're trying to breathe off some of the acid. You'll have increased hydrogen ions in the metabolic alkalosis can be caused by severe vomiting, excessive GI suctioning, diuretics, and just an excessive amount of sodium bicarbonate in the blood. Patients in a metabolic alkalosis state, they'll be restless initially, then they will likely become lethargic. Their level of consciousness will decrease. They might complain of dizziness, have some irritability. The nausea, vomiting, and diarrhea will be symptoms of this and what will make the imbalance worse. They will have the decrease in acid or an increase in the base. So you'll see the pH level above 7.45, and then the bicarb level is going to be above 26. The compensatory mechanism will be the respiratory system kicking into a hypoventilation state. So we want to retain the CO2 to correct this. When we go to interpret ABGs, we use a tic-tac-toe method. This is the easiest method to determine the imbalance and overall process. So we use a grid just like a tic-tac-toe grid to classify the pH, CO2, and HCO3 into columns. This allows us to determine if it is a respiratory or metabolic process. And then we determine, is the process compensated? And if it's not compensated, is it a partial or complete uncompensation? So again, the normal values for ABG, so our pH is 7.35 to 7.45. Your PaO2 is 35 to 45, and then the bicarb is 22 to 26. So you'll notice on the picture that the CO2 levels are reversed. So low to high levels for the pH and the bicarb, but high to low levels for the respiratory component. So when we have a level above 45, that indicates an acidotic process. When we have a CO2 that is below 35, that indicates a basic process. So anytime that we are going to interpret ABGs, just remember that the respiratory component is flipped when interpreting ABGs. So there are 3 steps to interpretation. First, we have to identify each value, so your pH, the bicarb, and the CO2 as an acidotic or alkalotic value. Then we determine if that value defines a metabolic or a respiratory process. So depending on which side your pH level falls, whichever coordinating value is also in that column. So if your pH is in the same column as your CO2, then it's a respiratory process. If your pH is in the same column as your bicarb, then it is a metabolic process. Then we have to determine if there is compensation present. So is there full compensation, meaning the pH has returned to that normal range, so in between 7.35 to 7.45. Partial compensation refers to your pH still being normal, so you do have an acidotic or alkalotic process present, but your compensating system is out of normal range. It's trying to pull that pH back into the normal range. So partial, your pH is still going to be abnormal, but your compensating system will be out of range. And then uncompensation refers to all values being out of range and neither system is working to correct the imbalance. So the first thing that we do is we're going to put our pH into its column. So you can see in the image, when we draw our tic-tac-toe grid, we put acidosis or acid on one side, normal in the middle, and then alkalosis in the right-handed column. And you would put your pH in the corresponding column. So we know that our range, again, is 7.35 to 7.45. 7.39 to 7.35 is a normal value, but because it's below that 7.4 range, we would consider the patient to be in a more of an acidotic state. If you have a value that is 7.41 to 7.45, again, still a normal value, but they're leaning towards that alkalotic side. So these could indicate that your patient is headed towards a more severe imbalance and would hopefully allow you the time to correct that imbalance before they become too out of range. Any level that's below 7.35 goes in that acidosis column. Any value that is above 7.45 goes in the alkalotic column. Then we have to identify our respiratory component. So again, the normal range, 35 to 45, but in order to interpret this in an ABG, we invert the value for the purpose of the tic-tac-toe method. So your range would actually be 45 to 35, 45 and above indicating an acidotic process, 35 and below indicating an alkalotic process. So depending on what your value is, that's where you'll place your PaCO2 in that column. Then we're going to identify the metabolic component. So this is the bicarb level, or HCO3. Normal range is 22 to 26, Any value below 22 is an acidotic value, and you would place it in the acidosis column. Any value above 26 you would place in the alkalosis column. So now we're going to solve for acidosis versus alkalosis. So it's going to depend again on which column your pH level falls into, or if it is that normal range. So if it is between 7.35 to 7.39, it is still a normal range, but it is leaning towards that acidosis state. So you would still have an acidosis, and then depending on which system falls in that column as well would be either a respiratory acidosis or a metabolic acidosis. Same goes for a pH level of 7.41 to 7.45, still that normal value, but it is closer to the alkalotic state. So it would be an alkalosis process, and then respiratory or metabolic depending on where those values fall. Any value below 7.35 goes right in the acidosis column. Any value above 7.45 goes into that alkalosis column. Here's where we will solve for the actual respiratory versus metabolic process. Depending on where your PaCO2 value falls and your bicarb or your HCO3 value falls, this will indicate whether it is a respiratory or metabolic process. So for the first tic-tac-toe grid, we see that our pH is actually normal, but it's leaning towards the acidosis state, and our PaCO2 value is also acidotic, so this gives us a respiratory acidosis process. The grid below that shows the pH fully in the acidosis column and the PaCO2 fully in the acidosis column, giving us a respiratory acidosis problem. You will see in both of these that your bicarbonate level is in the alkalotic state, so you would have a partial compensation with these because your pH is in the bottom grid, your pH is still in an acidotic state, but your bicarb is in the alkalotic state, giving a partial compensation. In the top grid, where your pH is in that normal value, you have a full compensation because your pH is normal and your respiratory and metabolic component are opposite of each other. For the metabolic grid, the top grid, you have your pH level that is in a normal range but is leaning toward that alkalotic state. So it is the alkalosis process, and then your bicarb falls in that same column, giving this a metabolic alkalosis interpretation. Again, you have full compensation with this process because your PaCO2 value is in the acidotic range, which pulled your pH back to a normal range. The bottom grid for the metabolic process, you have your pH and bicarb that are both solid in the alkalosis column, and then your PaCO2 is in the acidosis, giving this a partial compensation because your PaCO2 or your respiratory component is opposite of your metabolic component, but your pH is still out of range, so not fully compensated on this process. We'll talk further about compensation. Full compensation, so our pH has returned to that normal range between the 7.35 and 7.45. You have full compensation when your pH is in the normal range and your respiratory and metabolic component are opposite of each other. So they are doing what they need to do to keep that pH in the normal range. You have partial compensation when your metabolic process and your respiratory process are opposite of each other, but your pH is either acidotic or alkalotic. So you can have a partially compensated metabolic alkalosis, which is what that middle grid indicates, because your pH and your HCO3 are in the alkalosis column, but your PaCO2 is in the acidosis column, meaning this is a partially compensated process. When you have uncompensated state, so this occurs when either the PaCO2 or HCO3 are in a normal range. So you see with this one, the PaCO2 is in that normal column, but the pH and the HCO3 or the bicarb level are in the alkalosis. So your pH is abnormal, your bicarb is abnormal, and your respiratory system is not doing anything or not doing enough to compensate the process. So now we're going to practice interpreting our ABG values. We're always going to start by drawing our grid and labeling the columns acid, normal, and base, and then putting our values in the appropriate column. So for this result, we have a pH of 7.25, which puts it in the acid. Our PaCO2 is 33, putting it in the base. And then our bicarb, or HCO3, is 18, putting it in the acid column. So now we can interpret. We've got our pH and our bicarb in the same column, making this a metabolic acidosis, because the column that your pH falls in with the metabolic or respiratory process identifies which it is. So this is a metabolic acidosis, and because our respiratory component is opposite, so it is alkalotic, we have a partial compensation because your bicarb and your CO2 are opposite, but your pH is still out of normal range. So we have a partial compensation. Problem number 2. Again, you're always going to start by drawing your grid and labeling acid, normal, and base, and then placing your values in the appropriate column. So our pH is 7.45, and that is a normal value. Your PaCO2, or your respiratory component, is 31, making it alkalotic or base. And then your HCO3, or your bicarb, is 20, making it an acidotic. So in order to interpret this one, we have to look back at our pH because it is a normal range. But remember, above 7.4 makes it an alkalotic process, and below 7.4 makes it an acidotic process. So because we're 7.45, that pushes it over to the alkalotic process. So what we have is a respiratory alkalosis, and we have full compensation because our bicarb, or our metabolic component, is opposite our respiratory component. So again, this is respiratory alkalosis with full compensation. Problem number 3, again with the grid. Acid, normal, and base. Our pH is 7.1, making it acidotic. Our PaCO2 is 38, which is a normal value. And our bicarb is 17, making it an acidotic process. So what we have here now is a metabolic acidosis that is uncompensated, because right now the respiratory component is either not functioning properly or is not doing enough to compensate our metabolic acidosis. So this is uncompensated metabolic acidosis. Problem number 4, as always, with our grid acid, normal, base, and putting our values in the appropriate column. So we have our pH of 7.3, which is acidotic. We have a PaCO2 of 46, which is also acidotic. And then we have a bicarb of 27, which is alkalotic. So now we can identify this process as a respiratory acidosis with partial compensation because our bicarb and our CO2, or the respiratory and the metabolic component, are opposite of each other, but our pH is still out of balance. Now we're going to look at problem number 5, starting with our grid. Our pH is 7.42, which is a normal value. Our PaCO2, or the respiratory component, is 46, making it an acid. And then our bicarb, or the HCO3, is 28, making it an alkalosis process. So again, because our pH is normal, we have to take a look at which side of the spectrum it falls on. And since it's above that 7.4, it pushes it over to the alkalotic side. So we have a metabolic alkalosis with full compensation, because again, our pH is in that normal range, 7.35 to 7.45. And our respiratory component is opposite our metabolic component. So when we have the respiratory and metabolic components working opposite and our pH within a normal range, we have a fully compensated process. So this one would be metabolic alkalosis with full compensation. Problem number 6, again, we're going to start with our grid. Acid, normal, and base. Our pH is 7.28, which puts it in the acid. Our PaCO2, or the respiratory component, is 49, which also puts that in the acid. And then our bicarb, or the HCO3, is 25, which is a normal range for that. So first we identify our process, which our pH and our CO2 are in the same column, making this a respiratory acidosis. And because our bicarb, or the HCO3, is still within the normal range, we have an uncompensated process. Respiratory acidosis uncompensated. That is the end of this lecture. We reviewed respiratory acidosis and alkalosis and the processes that cause those. We also looked at metabolic acidosis versus alkalosis and what causes that. And then we reviewed ABG values and how to interpret those values to determine what process we have with our patient. So please practice more ABG interpretations. I will post a worksheet that is not mandatory to complete, but will give you extra practice for interpreting ABGs. Thank you.